Hi to anybody watching. This webinar is for GP practices who may be considering or are already taking part in the Yellow Card Biobank Study with Clinical Practice Research Data Link. To kick off, we can start with some introductions. So my name is Emily Houston and I'm a Senior Research Manager within the Yellow Card Biobank team. Hand over to Jamie.
My name is Jamie Soames and I am the CPRD study lead for the study and we'll be walking through the DART online platform that's used to review and invite patients a bit later.
Thank you. Okay, so the purpose of this webinar is to help you understand the aims of the Yellow Card Biobank pilot study, the eligibility criteria, the steps involved for both GP practices and patients who take part in the study, and as Jamie mentioned, how to get set up on the DART platform and how to use it to screen and invite patients. So the Yellow Card Biobank is currently in a pilot phase, this is being jointly delivered by the Yellow Card by the MHRA and Genomics England. Using pharmacogenomics, the biobank aims to improve understanding of how a patient's genetic makeup may increase their risk of serious harm from adverse drug reactions, and this will be done using whole genome sequencing techniques. The aims of the pilot are to firstly deliver proof of principle that a biobank is operationally feasible. So this includes trialling different ways of identifying and inviting eligible patients, one of which is working with CPRD, collecting biological samples, and ultimately delivering sequencing and health data to researchers for analysis. And secondly, to develop a financially sustainable model for operating a biobank at scale. To enable this research, we aim to recruit 100 patients who have experienced acute pancreatitis associated with taking a GLP-1 receptor agonist between now and Friday the 16th of January next year. The sequencing and health data generated from the pilot will be stored in Genomics England's research environment and can be accessed by approved researchers. It's important to point out that patients will not receive any individual results. However, the biobank will share overall findings from the pilot via website and newsletters. In case you're wondering how your practice can support the study, we're asking GPs to screen potentially eligible cases which have been founded in coded searches of the primary care record and invite those who meet the eligibility criteria to take part in the study. The next few slides will highlight the eligibility criteria, which we ask GPs to consider when screening patients for the study. To be included in the study, patients must be UK-based, aged 18 or over, still be alive, and have capacity to be able to make an informed decision about taking part. Lack of capacity to provide consent could be caused by a learning disability, dementia, or temporary factors such as confusion, shock, pain, fatigue, or the impact of drugs. Finally, patients must also have received a clinical diagnosis of acute pancreatitis following GLP-1 RA exposure. This next slide highlights which drugs and indications are included within the study. Patients should have been taking any of the following GLP-1 receptor agonists or dual GIP GLP-1 receptor agonists, and these include semaglutide, tirzepatide, lixisenatide, dulaglutide, liraglutide, and exenatide. For any of the following indications: type 2 diabetes, weight management, and cardiovascular risk prevention. In addition to the inclusion criteria already mentioned, the case should also meet the following adverse reaction criteria, which is also known as the phenotype. Both of the first two criteria are essential, and this includes drug use. So there must be a temporal association between starting the GLP-1 receptor agonist and developing the acute pancreatitis. For this study, that temporal association must occur within 12 months of the first prescription or within 12 months of the final dose escalation. The patient must also have been admitted to hospital as an inpatient for tests and/or treatment. There are a couple of additional desirable criteria, but cases aren't specifically being screened against these as part of recruitment. These include acute abdominal pain, consistent with acute pancreatitis, blood tests showing increased serum amylase or lipase levels, and characteristic findings of acute pancreatitis on imaging modalities such as CT, MRI, or ultrasound. This slide highlights the study's key exclusion criteria. So firstly, patients who were diagnosed with gallstones or bile duct stones and/or received treatment for this at the time of experiencing acute pancreatitis are excluded from the study. This would typically be confirmed by imaging, but the GP may be able to look at the treatment received if uncertain, and this would include an ERCP and/or gallbladder removal. And to note, this can still occur after a gallbladder has been removed. Patients who have previously been diagnosed with chronic pancreatitis, which is long-term inflammation of the pancreas, or hereditary pancreatitis syndrome, which is a genetic form of pancreatitis, are also excluded from the study. This next slide explains how the CPRD searches were structured in order to find patients who may be eligible for the study. These included patients who were 18 and over, had a prescription for a GLP-1 agonist between 2015 and September of 2025, and also a diagnosis of acute pancreatitis within 12 months of that prescription. We then excluded any patients who had been diagnosed with gallstones within 28 days of the acute pancreatitis and had a record of chronic or hereditary pancreatitis too. GPs are now asked to complete a screening form for these patients that were found in order to confirm their eligibility. My final slide demonstrates what's involved for both GP practices and patients taking part in the study. The reason that you're likely to be watching this webinar is because CPRD have contacted your practice as you have potentially eligible patients. If interested, you will need to sign a work order and GP agreement if not already done so. CPRD will then activate your practice, providing you with a patient list on the DART platform for a GP to review. If screening confirms that the patient is ineligible, there are no further steps for the GP to complete. If screening confirms that the patient is eligible, the GP is then asked to invite that patient to take part in the study. For this, our preferred approach is for the GP to phone the patient about the study to ask if they are willing to receive an invite. If the patient says yes, then the GP is asked to follow up by sending a study invite letter or SMS to that patient. However, if a telephone call isn't feasible or the patient can't be reached by phone, the GP is asked to send the patient an invitation letter followed by an SMS 2 weeks later. Patients can then access the study sign-up link and the study's materials directly from their invite letter or SMS. Once they have read the study materials, they can choose to sign up to the study by providing electronic consent, and once signed up, they are asked to complete a study questionnaire. If patients prefer, they can also receive study documentation in the post by calling the biobank team. The study team then coordinate the collection of a remote saliva sample. For this, collection kits are delivered to the participant's home, and prepaid packaging is supplied so that the patients can return the sample directly to the lab. We are hoping to collect some additional data via data linkage, but due to the setup times associated with this, we may also recontact the GP to ask for further details where possible about the patient's medical history. Finally, the samples are sequenced, and both the sequencing and health data are hosted in the research environment for access by researchers. I'll now hand over to you, Jamie, the DART demo.
Many thanks, Emily. So I'll be walking through the DART platform, which will be used to review and invite patients for this study. So just a bit of background, DART stands for the Data Analytics Recruitment Tool. We provide this tool to GP practices to review potentially eligible patients and, if suitable, invite them to a clinical study. And in this presentation, I'll cover setting up your DART account, logging in and finding your patient list, reviewing your patients, and finally inviting your patients if they're eligible. To the next slide. So once you complete the work order to take part in the study, we'll send you an activation email asking you to create a DART account. This will come from dartsystem@mhra.gov.uk. The email will provide you with a username, which will typically be your email address, and a link asking you to create a password for your account. If you already have a DART account, you will receive an email with a link to access the study directly on DART. Please click the link or go to dart.cprd.com to access that. Next slide, please. So once you click on the link to create an account, if you're a new user, you'll be asked to create your password. Here you see the password requirements listed: at least one uppercase character, lowercase character, one number, one special character, and needs to be more than 10 characters. Next slide, please. So you can also supply your phone number if you'd like to use this to log into DART. This can be used to receive the login confirmation code when you log into DART as part of the secure multi-factor authentication login system that is part of the system. Next slide, please. You'll receive a confirmation code on your phone, which you'll be asked to confirm here if you choose to use your mobile. Go to the next slide, please. You will then be able to log into your account using your username and recently created password. We suggest that you bookmark the login page, dart.cprd.com, so you can easily log in each time that you wish to access the study. Next slide. So as mentioned previously, DART does use a two-factor authentication. So you'd be asked to enter a security code every time you log in. This is sent to your email address or phone, and the default method is to use your email address. However, as I mentioned, if you wish to use your phone number to do this, you can actually select choose a different way to authenticate at this point. Next slide, please. You can then choose your preferred authentication method, which would be a choice between email or SMS. Next slide, please. Once you log into the system, you'll see the study listed on the welcome page. In the top ribbon, you can view all the studies you're involved in, see any notifications, and can change your account information under your profile if you would like to. Next slide, please. So you can now view your potentially eligible patients. You click on Show Practices, then View Patient List, or on the number next to the word New to see which patients you're being asked to review for this study. Next slide. Once you click your patient list, you'll be presented with the patient list page. There are two key steps which you need to do. One is to review the patients by answering questions about their eligibility, and two is inviting patients that you have reviewed as eligible. You can see here the EMIS or Vision ID of the patient on the far left column, which will enable you to identify the patient in your GP software. The next column is a study-specific patient reference number, which you will typically be asked to add to any comms with patients to enable the study team to have a reference for that patient. And the next column then shows the status of the patient review, and the final column enables you to take any action with the patient. So when you first access your patient list, all your patients will have the status of new because you won't have been able to take any action with them yet. The first step, therefore, is to review a patient by clicking on the blue Start Review button next to that patient. Next slide. Once you click this button, you will be presented with some information about this patient, why this patient has been selected. It covers how the patient search was conducted. As Emily stated previously, this will be because there was a GLP-1 prescription between 2015 and 2025, and an acute pancreatitis event within 12 months of this prescription, and that they had no record of gallstones, bile duct stones, chronic pancreatitis, or hereditary pancreatitis within 28 days of the acute pancreatitis event. A link to further information is also available here. And we understand that it's not always possible to precisely attribute causation at this stage. However, we do encourage that you invite the patient if there is a possibility that the potential side effect was linked to a GLP-1. You can also see at the bottom of the page the GLP-1 that the patient was prescribed, the date of prescription, and the date of the acute pancreatitis event in order to help navigate this review step. Next slide, please. You'll then be asked a series of questions to determine if the patient is eligible to be invited to the study. The first set of questions are inclusion questions. So if any answers are a no, the patient will not be eligible and cannot therefore be invited to the study. The questions are, is the patient still registered at your practice? Is the patient still alive? Do you suspect that a GLP-1 may have been associated with the onset of acute pancreatitis? Can you confirm that acute pancreatitis occurred within 12 months of the patient starting the GLP-1 or within 12 months of the final dose escalation? And was the patient admitted to hospital as a result of the reaction? Next slide, please. The next set of questions are exclusion questions. So if any are answered with a yes, they will not be eligible. The questions ask, was the acute pancreatitis likely to have been caused by gallstones or bile duct stones in the bile duct? Does the patient have known chronic pancreatitis? Does the patient have known hereditary pancreatitis syndrome? And the final key question, do you think there is any reason that the patient may not be able to provide informed consent for the study? For example, if the patient has a learning disability, dementia, or temporal factors such as confusion, shock, pain, fatigue, etc., they would likely not be able to provide their informed consent. Next slide, please. And once you reach the end of the form, if the patient is eligible, you'll be presented with this statement, which confirms that the patient can be invited to the study. You can then click on the blue complete button to continue, and this will change the patient status from new to reviewed. The save and exit button here will keep the status of the patient as new. This is in case you think you might want to revise the form later. Next slide, please. You will then be presented with a summary and next steps page where you have three options. One is to go on to invite the patient that you just reviewed. Two is to review the patient if available, the next patient if available. And three, return to the patient list if you'd like. Next slide, please. So going back to the review questions, if you answer a question which results in the patient being ineligible, you will see this statement explaining that the patient is not eligible and that they should not be contacted. You can then click on the blue complete button and no further action is necessary with this patient. Next slide. Now, just back to the patient list, if the patient is not eligible, you will see that their status is marked as not suitable or inaccessible, depending on the type of question that makes them ineligible. If a patient reviewed as not suitable later does become suitable for any reason, you can start your review again by clicking the blue Start Review button too. Next slide, please. Now back to the patient list for eligible patients. So once you've reviewed any patients as eligible, their status will change from new to reviewed, and you can click the blue Start Invitation button to get started with that. Next slide, please. You'll then be presented with instructions on how to invite the patient. As mentioned, the preferred method of information for this invitation for this study is to telephone the patient directly. There is a link to a telephone crib sheet which will guide you through what to say to the patient there. If the patient has any specific questions about the study, they can contact the study team. And if the patient is interested in the study following your phone call, you can send the invite letter adding key information, which I'll explain in a minute, in the post, or use the SMS invite. Links to the patient invite letter and SMS content are also provided on this screen. We then ask that a follow-up SMS message is sent to the patient 2 weeks after the invite is sent. If you're not able to make a telephone call to the patient, you can download the patient invite letter and add information, including your practice letterhead, the patient's name and address, the date, the patient reference number, the name of the drug suspected of being linked to the side effect, and sign off with your name and signature. You can then print and send the letter in the post. Please then follow up 2 weeks later with an SMS message, making sure to add your patient name, your practice name, the drug linked to the side effect, and the patient reference number, which can all be found on this screen. And finally, you must mark which method of invitation you used, either the telephone method or the letter invite letter, then click on the blue complete button. Next slide, please. And so once a patient is invited, the status will change to invited and no further action is necessary in DART. On this page, you can see the different statuses that are displayed when you conduct your review. So those who are new will be patients you haven't reviewed yet. Those who are not suitable are patients that have failed one of the review questions. Those who are reviewed are patients that you have found eligible and will need to complete the invitation step. Those who are inaccessible are patients that you have said are no longer registered at the practice or have passed away. And those who are invited are patients that you have confirmed are invited to the study. Next slide, please. Finally, you will be able to find supporting documents for the study, both patient-facing and practice-related documents. From the patient list, you can click on the Patient Approved Resources tab at the top of the page, then the Supporting Documents tab. Here you'll find a copy of the patient invite letter and SMS message content, which you can easily download there. Next slide, please. If you click on Practice Staff Resources, then Supporting Documents, you will find the Healthcare Professional Information Sheet, which provides background to the study and patient eligibility criteria. And you will also find the telephone invite crib sheet here to download if you'd like to download that there too. Next slide, please. This is the final slide. So many thanks for taking the time to watch this video. If you would like to have any questions about DART or conducting the patient review and invite, please contact studysupport@mhra.gov.uk. And if you have any questions about how to join the study, please contact gpnetwork@mhra.gov.uk. Thanks very much for listening.